Parkinsons is about how much sleep you really need at nighttime. Now, I'm going to talk about sleep hygiene here, but I could also talk about it at several other places in other parts of the lecture. But I'm going to talk about it here because it really does fit in the general theme of how to get a good night's sleep. Many of these recommendations I'm going to give you are particularly for people with insomnia, okay, so the inability to fall asleep or stay asleep. But many of them are also just good recommendations in general for anybody who wants to get a good night's sleep. So sleep hygiene does refer to the activities and habits that are consistent with or promote the maintenance of good quality sleep and daytime alertness, right? Because the whole point of sleeping is to be alert during the daytime. So the first one that we always talk about is developing regular sleep habits, okay? This is my experience with people my age and older is that this is not as much of a problem as with young people who love to just go to bed when they want and get up when they want. But it is very important that you try to sleep as much as you need to feel refreshed and alert. You should not spend more time in bed than needed. And you need to keep a regular bedtime and a regular wake time. And the general rule of thumb is your bedtime should really not vary by more than about 30 minutes night to night. Okay? I certainly vary my wake time a lot because on weekends I don't have to be to work. I'm going to sleep in a lot later than I do on the weekdays. But I'm pretty much 11 o'clock, my wife and I are sound asleep. Okay? And that's very important. To do not spend more time in bed than needed is also important because, as it turns out, our body associates bed with sleep. Okay, so for most people, you see your bed, you think sleep. Okay, but if you spend a lot of time in bed awake, your body slowly associates the bed with also being a place to be awake. And so actually could perpetuate your insomnia, okay? So it's very important that you don't spend more time in bed than you really need to, okay? You wake up in the morning, maybe give yourself 15 minutes if you want to see if you can fall back to sleep. But if you can't, you really need to get out of bed, okay? So that's a very important thing. So again, one should slow down and unwind before bedtime. That's very important. As I tell people, you don't want to be working right up until you go to bed. And working can be a lot of things: work, housework, anything like that. Bedrooms should be dark, cool, and quiet. We already talked about that. Daily exercise is fantastic for sleep. However, the time of the day you do the exercise is really important. Okay, so to promote sleep, exercise should be late afternoon, maybe very early evening, okay? But if you try to exercise at 9 or 10 o'clock at night, you're not going to go to sleep at 11, okay? But conversely, if you want to help a little boost to stay awake during the day, morning exercise is fantastic, okay? But if you really want to help promote sleep, anywhere from that 4 to maybe 7 o'clock range, it would be a good time to do something. Light snacks before bedtime. Key word there is light. Snack, okay, not a meal. But the old wives' tale of hot milk before bed really does work, okay? So having a piece of fruit or cookie, something like that, might actually help promote sleep. Obviously, though, you want to avoid anything with caffeine in it if you're going to do that, okay? Because that would just make things worse. And that's actually on the next slide. So these are the things you really should not do if you're having troubles falling asleep at night, okay? Now, if you can do all these things, get into bed, turn off the light, hit the pillow, and be asleep in 5 minutes, go for it, okay? But if you turn up the light and take a half an hour to fall asleep, these are some of the things you want to avoid doing to help you get a better night's sleep. So you should not nap during the day. Now, that has a lot of people say, huh? So I'll talk about that a little bit more as we talk about some of the disorders in Parkinson's disease. But if you're sleep deprived, napping during the day is fine. But if you can't fall asleep at night, then napping during the day is bad. It's just robbing the sleep you would normally get at nighttime and bringing it into the daytime. You should never force yourself to sleep. And by that I mean that you're in bed going, I gotta sleep, I gotta sleep, I gotta sleep. Guess what that does? It makes you more alert, okay? Because then all you're thinking about is falling asleep. So you can't force yourself to sleep. Don't take your problems to bed with you. And one of the things we encourage people to do with insomnia, bad insomnia, especially people who are, we call it worry and rumination. So people who get into bed and think about what's going on that day, what they're going to do the next day, you keep what's called a worry diary. So before you go to bed at night, you just write down everything. And if you got to make sure you know what you're doing the next day, you write it all down. And that sort of helps relieve that sort of mental stress before you get into bed at night. Again, no strenuous mental or physical activities just before bedtime. Obviously, you should not use caffeine or tobacco prior to bedtime. Now, both of those are stimulants, and so you clearly don't want to use them. Remember, caffeine is in a large variety of foods and drinks, okay? Tea, coffee. I heard chocolate out there, that's right. A lot of different sodas have caffeine. So you want to make sure it's an herbal tea, decaf coffee, something like Sprite or Sierra Mist that have, no caffeine in it, okay? And then finally, you don't want to read, eat, or watch TV in bed, okay, if you have problems falling asleep. All of those, again, promote being awake in bed, okay? And the more you're awake in bed, again, the more your insomnia potentially can get worse. So you can do any of those things prior to going to bed, okay? Just not in bed. The other one that I don't have, I probably really should update these slides. I reuse slides a lot, and I always remember it after the fact. Computers. Computers are an interesting phenomenon in our society, as you are all well aware, I'm sure. They're now considered one of the major reasons for insufficient sleep in the United States, and I'm sure Canada would be the exact same thing. Computers, though, the problem with computer versus a TV is that in a TV, in theory, we're sitting probably 5 to 10 feet away. So the light from it is more diffusive. When you're at a computer, you're sitting right in front of it. And that light is actually stimulatory, okay? I actually been advising more and more people that they really want to avoid a computer for a couple hours before they go to bed if they're having trouble falling asleep in the first place, okay? And the other thing you might want to do is keep your lights low in general at nighttime because, again, bright lights at night are stimulatory and they're going to make you want to stay awake. Now, this is just a couple slides to show you a couple of the sleep disorders we're going to talk about do require you to come to a sleep center to actually have them diagnosed. And just to show you a little bit about what happens in a sleep center, this is a nice diagram of showing a gentleman sleeping. So generally, for most people, it's not totally clear, but there's a bunch of sensors on the head. And that tells us the different stages of sleep that you're in. There's sensors at your nose and around your waist, and there's a finger probe for your oxygen levels. That tells us all about whether or not you have sleep apnea or not. Generally, people are wired up. It comes out into a data monitoring room. This is a picture of an actual patient. And if you look, it's hard to tell. Yeah, there's also it was not in that other one, but you also see there's a bandage here on his leg. That's because there's an electrode on his leg as well. And that's where we can look for leg movements during the nighttime. Generally, what we do then is we monitor them overnight. This is just 1 minute worth of sleep study. Obviously, the people are sleeping anywhere from 7 to 8 hours. So we're collecting about 900 pages of data every night. Every 30 seconds is a page of data. And then basically we have technicians who score these, and then we physicians interpret them. and use them as a basis for making diagnoses. This particular slide shows us sleep apnea, which is one of the disorders that we're going to talk about in a few minutes. For most people, sleep centers are actually a reasonably comfortable experience. Most people are worried that they're not going to be able to sleep there, but most people are able to without a problem. The requirement is private room. Most of them are set up basic motel type quality, so it usually is quite conducive to falling asleep. And it is important for a couple of the disorders we're going to talk about. So moving on to Parkinson's and sleep disorders. So depending upon the study you read, most of them will say that the majority of patients with Parkinson's will have sleep complaints. But again, the percentage varies by the study population surveyed. Okay, so depending upon if you go to a Parkinson's disease center versus potentially just doing a more general survey of Parkinson's patients in a larger cohort, if you go to more general neurologists versus a specialized center, you're going to find slightly different numbers there. But in general, the more older you are, the increased severity of your Parkinson's disease, if you're a male, and if you're on higher doses of your dopaminergic therapy, you are more likely to have a sleep disorder. So this is just a couple of data slides. I try to not put data slides in this lecture, but I put in a couple just so you have a sense of some of the numbers I'm talking about. So this was a study actually from the Netherlands of 234 patients with Parkinson's disease. You can see that they were older, 72, had the disease for about 7 years of time. And importantly, some of the things down here are what's important. So about 12% of them had symptoms consistent with obstructive sleep apnea. About 13% had symptoms of the REM behavior disorder, which we're going to talk about. What number is that one? 56% had restless leg syndrome. A lot of them had problems with nightmares, frequent movements during the night, napping during the daytime, and a large number with inability to turn over in bed, and that's a major problem with insomnia, for instance, with Parkinson's. So you can just sort of see the range here of the different disorders that can be seen. This was actually a more structured survey of 1,000 patients from different centers in Italy. And these are sort of the major syndromes. They got about 30% of them with the REM sleep disorder, 37% with insomnia, 20% with excessive daytime sleepiness, and about 15% with restless legs. And then they had about 58% with fatigue that were limiting the patient's day activities. Now notice there's a difference here between excessive daytime sleepiness and fatigue. And to explain that difference is difficult. It's still one of those things that in medicine, asking it the right way, asking the right questionnaire can be very difficult. Most of the time, fatigue, to a physician at least, usually means a more day-long sort of feeling of tiredness, inability to do things, as opposed to excessive daytime sleepiness, where you're actually going to fall asleep, or you might doze off, okay? You can be fatigued without ever dozing off during the daytime. The converse is not true. Most people who are excessively sleepy are also fatigued during the day. But although in theory you don't have to be, but you can be fatigued without ever being sleepy, and that's just what they're trying to get at here. You can see that 58% of people have fatigued, but only about 20% of them have excessive daytime sleepiness. So we do try to separate them. I'm not going to talk a lot about the fatigue related to Parkinson's, although as it ends up, it's often treated the same way as the excessive daytime sleepiness is. So this is just a nice little schematic of how the different, some of the different